Hi, my name is Mike Wang. I'm a doctor and a neurosurgeon. I've been doing spine surgeries for over 20 years, and I'm also one of the founding members of a company called Kinesiometrics. Kinesiometrics was born out of a need. In performing surgery and seeing patients and taking care of them day after day, we've been using measures to try to determine how well we're doing. If you will, sort of like a report card. These report cards come in many forms, the most fundamental of which is called a PROM, or a patient-reported outcome measure. PROMs are like a patient-driven survey for the patient to indicate to us how they're doing, how they're feeling, how they've done with a surgery or a new drug or any sort of intervention. And so they've been a very useful advance in terms of measurement in medicine. But they are dated. Kinesiometrics was interested in a new future where we could actually measure patients a little bit more granularly. We could actually track them temporally, so instead of doing, say, a survey response every 3 months or just sporadically with people coming to clinic, but actually being able to do it hour to hour, day to day. We've developed a way to use the smartphone to abstract information, to get a good sense of how humans are performing, and in that way we can actually measure the effect of an intervention, for example, like a surgery. I'll give you an example why this is needed. All too often, as a spinal surgeon, I'll do a surgery that's successful. A patient who was very much in pain and maybe even wheelchair bound has a surgery with me and does beautifully. And they come to clinic and they thank me and they bring something like a gift, and we get them to fill out a survey at that time. And that's the way typically research is done. We see people after a surgery at various time points, like 3 months, 6 months, 9 months, and a year. But we also know those captured time points don't always give a good sample of what's actually happening with the patient. I'll give you another example. A patient of mine is doing very well for the first year after surgery, and then right around that time they're in a car accident. And now they have a new problem. Maybe it's not even spinal related. Maybe their knee hurts or they have a headache, and they come in and they fill out a PROM. And then that PROM captures in one time point a very specific element of maybe sampling bias, because it could be the next week that patient's all better again. I'll give you another example. If a patient's doing especially well, or especially trying to please me, the patient may fill out their PROM or survey result in a way that reflects how much they appreciate what I've done for that patient, right? In either case, the sampling has been a bit biased. So why not have a more objective way to sample patients' responses to interventions, whether it be for a drug for depression, a cardiac catheterization, or a spinal surgery. With this, I want to introduce you to Kinesiometrics and our new measurement called ORBIT, which stands for Objective Real-Time Bioinformatics Tracker. ORBIT is one of those modern diagnostics that allow us to really assess how is a patient doing, how is a person doing, how are they feeling. And with our patented technology, we're able to actually abstract at a quaternary level with the big data how people perform. This overcomes all of those biases we see every day with traditional PROMs, whether it be sampling bias, right? Whether it be a Hawthorne effect. These are elements that ORBIT gets around, and hence its objectivity. So I welcome you to join us and Kinesiometrics on our journey to measuring human function and potential.